that, just a quick recap. Last week, Thursday, we discussed about the step-by-step guide for already cancer survivors. So for those of you who missed it, just replay on our YouTube channel, search for Simply Nature, and don't forget to subscribe while you're at it. Moving on, without further ado, let me call on our seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore, Mr. Shyan Lim.
Jhen, and hi everyone. Again, welcome to another episode of Simply Healed. Today is actually our 165th episode.
Wow.
That means we've been doing it for 3 years without break. I think even during Christmas season, we are doing our show. Well, tonight's topic is very timely. Timely for me because I've been talking to quite a few oncologists. I was talking to a pediatric oncologist, one of the first in Philippines actually. And I'm hoping that one day, Doctora will be able to come on our show to answer specific questions and give everybody some insights about pediatric oncology. So that will be a special episode for parents who have their loved ones, their kids who are undergoing cancer treatment, all right? But we did talk about immunotherapy, and I was also in Mindanao speaking to a group of oncologists, and we were talking about chemotherapy, immunotherapy, and one of the, I guess, the challenges in immunotherapy has always been the cost. And in Mindanao, the hospital that I was at, they had a lot of sponsorship by the government. So the government actually, the Philippines government actually supports chemotherapy because immunotherapy will be a lot more expensive. However, it is something that is effective. So tonight we'll be talking about that, okay? And then you can make a decision on whether you want to explore this option or not. So I'll hand the time back to Jhen, and I'll see all of you at the AMA, which is the Ask Me Anything segment, where you can ask any questions you want in about 20 minutes time, all right? So Jhen, I'll hand the time back to you.
Thank you, Sir Shyan. Of course, it's an honor to present our second esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Let's all watch this.
Hi everyone, welcome to another episode of Simply Healed. And again, we have our regular Dr. Jansen with us today.
Hi, hello Shyan, hello everyone. Glad to be here again and welcome to Simply Healed.
Today, Doc, we want to talk about a very exciting aspect of cancer treatment, which is immunotherapy.
Yes.
Doc, the thing that struck me most about conventional immunotherapy, or really for conventional immunotherapy, is that we always have the understanding that when you go for immunotherapy, the drugs will strengthen our immune system, and that's how we defeat cancer.
Okay.
Is that the right understanding? Because you were telling me actually immunotherapy is like vaccination.
Yeah. So what you just said is wrong. Okay.
Oh, it's wrong, everybody. Okay, so immunotherapy is not to strengthen your immune system. So how does it fight cancer then?
Okay. Immunotherapy. So with the words, right? Keywords. Immuno, which means immune system. Then therapeutic. Yeah. So with this class of anti-cancer drugs, it's basically using your immune system to destroy the cancer cells. Okay, so how does it do that? It does not boost in whatever way your immune system. What it does is to help your immune system recognize the cancer. Okay? In that way, it's really similar to vaccines. So vaccines, as everyone already knows how vaccines work, right? So the vaccines is it's the virus itself without the fangs. Okay, so it's given to you so that your immune system will be able to recognize the
virus.
the virus without the fangs, no? So that the next time that you
Recognize
get
it.
infected with the virus enters your body the next time around, your immune system can easily overwhelm the virus. So it's sort of like, helping the immune system recognize, okay, this is the enemy. Okay, so immunotherapy also works in that way, right? So I'll give you a specific example right now.
All right.
Okay, so for all of those, for those of you who are breast cancer patients, okay, breast cancer has a certain type, okay, HER2 positive. I'm sure those breast cancer patients out there
Would
is
know
very
what that
familiar-
is.
Yeah, will know what this is, what I'm talking about. Okay, so if you get a HER2 positive breast cancer, okay, as a drug that is always given to you is trastuzumab. Trastuzumab, the proprietary name, trastuzumab is the generic name. The proprietary name is Herceptin. If you are familiar with that, no. So what trastuzumab does is, okay, first, what is trastuzumab? Trastuzumab is a monoclonal antibody. Okay, so antibody. Okay, so the pill in itself has antibodies for what? For recognizing the HER2 receptor. So HER2 is a receptor that is expressed on the surface of the breast cancer cell. Okay? Now, usually when HER2 is when you're HER2 positive, usually that's aggressive. But with that HER2 positive receptor poking out of the breast cancer cell and you being given trastuzumab, the trastuzumab will function as a bridge between your immune system and that breast cancer cell, so that your immune system can recognize, okay, this is the breast cancer cell, I will destroy the breast cancer cell. Okay, so that's how it functions.
So, Doc, clearly it means that we always, I was one of them too, and I think many of the patients, maybe even some patients who are going for immunotherapy today, your understanding of how immunotherapy works might be that common misconception, is that the drug that you're taking is strengthening your T cells, your NK cells, the cells that kill the tumor. No, it's not. Immunotherapy creates the bridge between your immune system and the cancer cell. So it helps your body recognize the cancer cell. Doc, for conventional immunotherapy, that means the one that we get from our oncologist, the normal protocol is first to combine it with chemotherapy?
Usually, but it's case to case. But more often, depends on the stage as well, no? If you are on a more advanced stage, usually what oncologists do is to start you on chemotherapy first. Then once you're done with chemotherapy, they start you on immunotherapy.
Why the chemotherapy first?
I would surmise, no. It's because number one, chemotherapy can be given for a shorter period of time. Because immunotherapy, usually you would have to be on it for around 2 years. Okay, so longer period of time. So, but aside from the timing, okay, it's because chemotherapy is sort of like a nuclear bomb. So you bomb all of the cancer cells first.
Make them weak.
Make them weak. Try to shrink them enough so that your immune system, once you are already given immunotherapy, your immune system can, easily pick off the smaller bits and pieces of the tumor or the cancer cells. Okay, so it sort of like works like that. And also, why chemotherapy? Why do we need it? I'm always, if you have noticed, I'm always advocating should use all options that is available for you.
All options.
Yeah, all options. It's because cancer cells can evade the immune system. In the first place, that's why they grew. It's because they were able to evade the immune system in the first place. Okay, that's why it's there. So now, with that, knowing that, it's not enough to boost your immune system alone. Yeah, it's not enough to give you immunotherapy alone. Okay, you should be able to kill off those cancer cells that has been evading your immune system. Okay, and then afterwards, then target the
ones that your
the
immune system can recognize.
Okay, to target the more specific, the smaller cells, because in that way it's easier to pick off smaller bits and pieces
Yes.
of cancer cell rather than a big chunk of tumor, right? It's always very difficult to fight cancer if the headquarters is there. Okay, so that's also one of the reasons why, yeah, we need surgery as well. Okay.
Wow, Doc,
So-
thank you for that very clear explanation.
Mm-hmm.
And Doc, how would you then position or share how does Simply Nature's liquid extract work as a natural immunotherapy?
So, Simply Nature PPARS liquid works in both phases, the chemotherapy and the immunotherapy phase. Now, the benefit of the Simply Nature liquid extract in the chemotherapy phase is to preserve your bone marrow. Okay? So, one of the side effects of chemotherapy, I'm sure all of you know, your blood cells count usually decrease. You get
Yeah, both your
anemia,
red and white
yeah,
blood cell
both-
counts.
Yeah, everything. Okay, so your platelets, your white blood cell count, your red blood cell count, yeah, those decrease. Why? It's because chemotherapy can be toxic to the bone marrow. The bone marrow is where these blood cells form. Okay.
So, Doc, it's so important. If any of our patients and listeners are planning to go for immunotherapy, which is expensive,
Yep.
and they have to go for chemotherapy first, then it's imperative. It's so important that they protect their bone marrow, because if the bone marrow is compromised due to the chemotherapy, the immunotherapy
Yeah, it won't work as much.
it won't work as well.
Yeah.
So to all our viewers on the program, if you are ever planning to use immunotherapy and you have to go for chemotherapy first, then do something to protect your bone marrow, because your immunotherapy does not strengthen the soldiers that are produced by the bone marrow. The immunotherapy provides the bridge for your soldiers to recognize the cancer cells. Now, if your bone marrow is destroyed, the immunotherapy's efficacy will also drop.
Yes.
All right.
Exactly. Okay.
Exactly.
Yeah.
All right. Now, Doc, we know that our pipa liquid extract, Simply Nature's pipa liquid extract, protects the bone marrow, but our extract also improves dendritic cells.
Mhm, yeah.
So, am I correct to say, because you helped to explain that the vaccine or the immunotherapy, I'll use terms that for our viewers easier to relate. So, the immunotherapy is like a vaccine for the cancer. It's tailored to a particular strain of
Cancer, yes.
and cancer can mutate, but often not so much.
Yeah.
But there is a chance.
Yeah, there's a chance. Yeah.
So that would mean that it's important for your own dendritic cells to also do their job.
Yes, they should be able to do their job well as well.
So PPARS liquid extract would actually work together
Mhm.
with immunotherapy. The immunotherapy drug will send most of your soldiers to attack the main tumor, because your soldiers can now recognize the cancer tumor. But it is important for your dendritic cells to still be working. You cannot depend only on the immunotherapy drug, because what if your cancer mutates differently from the immunotherapy drug? Then you really need your own body's dendritic cells to identify this small breakaway guerrilla force and kill it before it becomes recurrence, right?
Yes.
Yeah, because you can have a successful immunotherapy after chemotherapy and you can go into remission.
Yeah.
But the recurrence happened because it broke off,
Mhm.
escape detection, because this new strain was not designed for the immunotherapy drug. Just like we now ask, right, for COVID-19, whether Sinovac is effective, and it's true that Pfizer is the most effective.
Yeah.
So Pfizer dealt with mutation much better than AstraZeneca and Sinovac. So it very could happen to you also that your immunotherapy for your particular cancer might not deal with the mutation as well. So you need to make sure your own dendritic cells are active. And for that, it is proven Simply Nature pipa liquid extract improves dendritic cell activity.
Yeah, and not only dendritic cells, okay? It has been shown, an observational study, dendritic cells, not only dendritic cells increase, but the natural killer cells, which is actually the soldier that destroys all foreign bodies, all abnormal cells, okay? It's the natural killer cells also increase, your T cells also increase. Okay, so that's that's also one of the benefits of
So that
liquid
means,
extracts.
Don, I mean, from what you are sharing right now, it sounds like that the immunotherapy drug, conventional immunotherapy drug, strengthens the bridge, but does not strengthen the soldier.
Yes.
However, Simply Nature liquid extract strengthens the soldier. So that means it's a good pair up.
Yeah, it's a good pair up. It's actually should be almost always given together. Yeah, but I would the strategy that I would do is to give PPARS extract first before you go for the immunotherapy.
Oh, strengthen the soldiers first.
Strengthen the soldiers first. Make it really sensitive. Then give the bridge.
Give the bridge, and the soldiers will cross the bridge and attack the cancer cell and help you win the battle, win your fight against cancer.
Yes.
Doc, I think we've highlighted so many interesting facts. I hope that the viewers are really getting understanding because we're seeing questions come up. So let's go to our Ask Me Anything session, and I'm quite sure there'll be lots of questions about immunotherapy today.
Yeah. All right. See you in the Q&A.
There we have it. So at this point, questions are very much welcome. Just type them down in the comment section below. Kahit Tagalog, okay lang po. But just before we go to our AMA or Ask Me Anything portion, quickly, I just want to greet our avid viewers, Amelia Rivera, Flor Delina Duropan, Edna Alarcon, Kristen Banog, and Miss Mimi. Hello po. Now, to answer all your questions, in this modern world filled with noise of different health opinions, only trust the ones from the experts. May I call on once again Mr. Shyan Lim.
Hi everyone, so good to see everyone tonight. Tonight, Dr. Jansen is actually upgrading himself. He's actually having another specialty under his belt, which is he's taking on TCM. So tonight is just going to be me, but I'm going to do my best to answer the questions. As you all know, I specialize on the science behind PPARS and PPARS protocol, but I'll do my best to answer the other questions as well.
Okay, I can see a lot of questions coming up and thrown privately, so let us start the live AMA or Ask Me Anything portion. First question coming from Karen Cruz. What are the potential side effects and risks associated with immunotherapy treatments?
Actually, immunotherapy, every immunotherapy drug has its, how shall we say, its specific drug limitations and side effects. Nowadays, it's actually very easy, right? Whatever your uncle prescribes to you, you can Google it, all right? And then they will have a very specific list of side effects to come out where you can refer to. Now, in general, the side effects of immunotherapy are a lot less, very diminished compared to chemotherapy. So that's why immunotherapy is actually the therapy of choice if finances is not an issue. But some immunotherapy like trastuzumab that Dr. Jansen talked about, these are actually quite affordable. So again, depends on the cancer that you have, right? Explore the option of immunotherapy. For breast cancer, a lot of immunotherapy, like for HER2 positive breast cancer, is actually relatively affordable. And again, in general, immunotherapy has less side effects than chemotherapy because chemotherapy is like blanket bombing the entire body, right? Even although today chemotherapy drug has also been improving and is more targeted. They have ways to deliver the chemotherapy to the specific location, and they have improved chemotherapy drugs so that the side effects is less. Now, again, don't worry about both chemotherapy and immunotherapy because Simply Nature PPAR protocols will help strengthen your body against all the negative side effects from chemotherapy and immunotherapy as well. Jen?
Thank you, Sir Shyan. Next question, okay, from Facebook, Christine Banog. Can you go on immunotherapy without chemotherapy first?
Yes, you can. In general, chemotherapy is first used to reduce the size of your cancer tumor, right? To weaken the cancer cells in your body first, right? But again, depend on the type of cancer that you have. you have to check with your onco. It is possible to go straight into immunotherapy, for example, in the case of breast cancer, and also depending on the staging of your cancer, right? So, like for cancer, what we can share on the program is very general, unless you give very specific examples about your case. Yeah, but the good news is, yes, it is possible to go for immunotherapy without chemotherapy. However, it's case-to-case basis. Now, it is very likely that you will combine chemotherapy with immunotherapy. Sometimes chemotherapy actually increases the effectiveness of immunotherapy. However, because it sensitizes the body, the cancer cells to the effects of immunotherapy. However, chemotherapy will always damage your immune system, all right? Because it will it will damage your bone marrow cells, your spleen cells, and these are very important parts of your immune system. As you learn from today's discussion with Dr. Jansen, most immunotherapy works by detection. Okay, they don't actually strengthen your body's ability to fight the cancer cells directly. It works a lot like vaccines. Okay, so most immunotherapies mechanism of action, or the science behind the immunotherapy, most of them are targeted towards identifying the cancer cells. So here's an interesting fact that was not covered and you may not know. Cancer grows in your body without being detected and without being overcome, because cancer cells have a cloaking device. They are like ninjas, all right? Your own immune system have difficulty identifying the cancer cell. Because your own body's immune system does not identify the cancer cells, your NK cells, your T cells don't target the cancer cell. So immunotherapy works by making the cancer cells targetable. So basically, what immunotherapy does is it paints the cancer cell like red in color. So then after that, your own immune system is able to recognize it, and your own immune system does the killing. Now, doesn't that sound exactly like your COVID vaccine, your HPV vaccine? That's how vaccines work. They make the virus identifiable. So immunotherapy often works on a mechanism making the cancer cells identifiable. So in the first place, you have to understand cancer successfully grows in your body into a tumor because it has the natural ability to hide from your immune system. Okay? Now, Simply Nature PPARS actually also boosts your immune system's dendritic cells. Now, what are dendritic cells? Dendritic cells are cells. Their job in the immune system is to identify the wrong cells, to identify the virus, to identify the bacteria, to identify the cancer cells. So by taking PPAR protocols, for example, of PPAR powder extract and liquid extract, you are actually going to help your body detect cancer cells better. Now, you can imagine the effect, right? Combining the immunotherapy, which removes the cancer cells' ability to hide, and then with the PPAR protocols, which increases your body's ability to detect. So that's a wonderful combination, right? One exposes, one shines the light, the other one makes, can you imagine your dendritic cells are like those security dogs, you know, the dogs that sniff you at the security checkpoint to sniff for gunpowder or drugs. So imagine the PPAR protocol makes the nose of your security dogs, which are your dendritic cells in your body's immune system, makes them more sensitive. And then the immune system, and then the immunotherapy shines the light so that it's very hard for the cancer cell to hide. Now, this combination is definitely going to help each other. And that's why Simply Nature PPAR protocols are very good in supporting immunotherapy. And again, back to this question, for many early stage cancer, you might not need to go for chemotherapy. You can go straight for your targeted therapy, which is your immunotherapy. But if you are in the late stage cancer, very often the chemotherapy is needed to weaken the cancer cells first, so that it's easier for your immune system to tackle the cancer cell. Now, in that case, the PPAR protocol will protect your immune system from the chemotherapy and then help your immune system when the immunotherapy is being used. So again, I hope this we answer many questions, and you will know how everything works together. Jhen?
Thank you for that very detailed explanation, Sir Shyan. Our next question is from Anna Sobrehana. How is the effectiveness of immunotherapy monitored during cancer treatment?
Okay, this one, Dr. Jansen will be in a better position to answer, all right? But how is cancer monitored during the entire treatment? Okay? Cancer monitors are, the effectiveness of the cancer is going to be monitored by diagnosis. So as Dr. Jansen said, imaging is one of the key ways, right? What does it mean? You can always use cancer markers, so blood works, right? So blood works, they check for example, PSA levels. Okay, this is because when your body is fighting cancer, the biochemistry in your body will have reactions. So then there'll be byproducts. So you will take a look at your PSA levels. If it's elevated, that means, yeah, okay, that means the body is really fighting cancer. So that means your cancer cells are there, right? Now, if the PSA levels drop, it means that your body's immune system is not so active, which also implies that the cancer cells are less. That's why your PSA levels are lower. So that's how the chemistry part, biochemistry part, where you do your blood works. Okay, that means you do your blood test. That's what they use to find so-called cancer markers, right? Cancer markers. So some blood works are also to detect the presence of certain enzymes and cancer cells in your body. So that's by blood works. Now, what is really important you can't rely on blood works alone. Okay, the reason is because there are other reasons why your PSA level might be high. There might be other reasons why your neutrophil levels are high. You could be having a chest infection. You could be suffering from, for example, pneumonia. And that will also cause the same immune cells to be very active, like your neutrophil cells, right? And that will also be interpreted. It can be interpreted as the same positive result as active cancer cells. So that's why blood works cannot be taken alone, all right? So what is, Dr. Jansen was talking about this last week. So what's important in monitoring your cancer, especially for cancers that are later stages, and of course that you have a cancer tumor, is imaging. It's imaging. So imaging means that they actually take a picture through different ways. You can go for MRI, you can go for CT scan, you can go for stain. So stain, that means they will inject radioactive material into you, and it will light up if there are cancer cells in your body, right? So imaging can be measured to see the size of your tumor, the concentration of the cancer cell. So that's the most direct and I guess effective way to know whether your treatment is working, be it chemotherapy or immunotherapy, right? So you still go for imaging. For example, ultrasound, you can measure your tumor size. It shrank from 5 centimeters to 3 centimeters. So such evidence is very clear that your immunotherapy is working, right? So depending on the cancer type that you have, your oncologist will have very strong and clear guidelines. How often should you do an imaging test? Okay, and how often should you do your blood works? So that's how you monitor. Now, you can't monitor some people say, can I monitor because I feel well? Okay, that's feeling well, feeling strong, healthy, feeling good is very important for your fight against cancer. Now, if you're feeling very weak, that means your body is weak, which means it's going to struggle and have a hard time fighting cancer. Now, because you feel strong, it does not necessarily mean that you're beating cancer, but it does mean that your body is in a better condition to fight cancer, right? So don't just know whether something is doing your cancer fight is well simply by how you feel. Okay, but is it important how you feel? Very, very important. Okay, because if you feel weak, if you're weak, it's going to be difficult to beat cancer. So you want to be strong, you want to feel energetic, you want to have appetite. All this you want, but you can't avoid, going for your imaging tests. Okay, and if the imaging test shows that You are getting stronger, you feel better, yet your tumor is not shrinking. Is that good news? I would say that's good news. Why? Because that means your body is feeling strong, you're feeling stronger. Okay, the tumor is not shrinking. The oncologist and your doctor can now use stronger methods to attack the cancer cells. Why? Because you are strong. Because your body can take harsher measures to treat your cancer. So all this, I hope is giving you a good understanding and that you should be encouraged every time you feel stronger, you feel better, okay, that you're more alert, better appetite, stronger energy. All these are good signs. However, it doesn't mean that you can ignore the imaging scans and going for your blood works, okay? Because many people find out they have fourth stage cancer. Why do they find out that they have fourth stage cancer? Because during stage 1, 2, and 3, they felt fine. They didn't feel anything wrong with them, right? So some cancers you don't feel until it's too late. So don't use your feeling as a gauge to whether your cancer is successfully treated or not. But again, if you feel strong, it means you're in a good position to defeat your cancer. Does that help? Does that answer the question?
Yes, thank you, Sir Shyan. I hope that enlightens our avid viewers like Dennis Morales from Parañaque, Joy Cabrera, and Miss Minda Vanella. Okay, next question from Facebook from Miss Abby Velus de la Cruz. Good evening. Does HPV vaccine help fight other cancer cells in the body? Thanks.
Okay, the main reason for HPV vaccine is that this is one cancer that's actually caused by a virus, all right? So, yeah, the main purpose is to prevent you from getting that. Okay, but getting infected by HPV virus. And the result of HPV virus will be, what's that called? Ovarian
Cervical
cancer.
cancer.
Cervical cancer, okay? So, yeah. Now, if you're going to be sexually active, okay, then even if you're not going to be sexually active, it is a good reason. Dr. Jansen is a very honest and faithful man. Okay, now he didn't get he got a HPV vaccine. It doesn't mean he's a player. Okay, it's just that he wanted to protect his partner as well and protect himself. Right, because when he took it, he was still young. He never knew who he would fall in love with. So he vaccinated himself in case his partner was more active before she met him. So again, getting a HPV vaccine is a good idea. Okay? And nowadays, some companies actually sponsor that. So if your company sponsors that, go ahead, right? It's free and there is no downside to it. Jhen, I saw a question by Miss Amelia Rivera, and I think I want to answer this one. But do you see that question?
Yes, sir. Let me
Yeah,
read
maybe
it
you can read
first.
out the question. Yeah.
Yes. So for our viewers, there's a question from Miss Amelia Rivera on Facebook. She says, until now, I'm still curious why oncology doctors, if not all or some, does not agree with such treatment like yours. So can I have your honest opinion, po? Thank you.
Okay. Now, if you were to speak to me 5 years ago, I would totally agree with your answer, your question. And my answer 5 years ago would have been that, which is going to be the same as tonight, lang, okay? Which is most doctors. Let me think about it. Let me phrase it correctly. Okay. Do you notice? Okay, do you notice there are many doctors that say acupuncture is crazy? How can you poke someone with a needle and then they get well? All right. But now today, many medical doctors and surgeons are actually attending TCM classes and learning to become acupuncturists. So like I shared with you guys, I actually went for a TCM course, a familiarization course, and I actually took an actual TCM course in acupuncture. And my classmates, out of a class of almost 30 people, only 4 of us were not doctors. Everyone else was a medical doctor. There were even specialists. For example, there were there was one Dr. Jhen in my class who is a rehabilitation specialist. And he's not just a rehabilitation specialist. He's a rehabilitation specialist who owns a huge clinic with a very successful practice. Yet he took on TCM because there was a limit to what he could do for his patients when it came to pain management. Okay, so my first answer to Miss Amelia, my honest, true opinion is this. Doctors stick within their scope of knowledge. If you ask a doctor a question about the heart and he's a nephrologist, he would actually refrain from making comments. Okay, and there are actually very strict rules about doctors making comments outside their own specialty. I just had a conversation with a very senior surgical oncologist, and he was just saying that in Philippines, a surgeon cannot touch an endoscope. That is a restricted instrument that is in the specialty of the I can't remember, it's a gastro specialist, intestinal specialist. Now he was sharing this because it was very silly and frustrating. Okay. Give you a reason, I give you a clear reason why. Okay. So in order for a surgeon to, let's say, cut up your stomach, he cannot look into your stomach or your intestines himself. He has to trust the GI specialist, and the GI specialist has to describe to him in words and imaging, making comments on the image, all right, to tell him what he saw. Now, let me ask all our viewers tonight, if you were a surgeon, would you prefer to look at the inside of your patient directly yourself, or would you prefer that you listen to someone tell you what he sees before you cut the patient? And if you were a patient, would you prefer that? In Singapore, in Australia, in the US, there is no restriction for surgeons to do the endoscopy themselves. All right, but here in Philippines, I was informed that because of interspecialist, I guess, restrictions, you can't. So a surgeon has to trust his other specialists to tell him where the thing is, what the thing looks like, and then he cuts. Okay, so this, Miss Rivera, I'm just sharing with you that many doctors are restricted to their area of specialization. This might be because of medical regulations and rules in Philippines. So this is why your oncology doctors will not agree with non-standard approaches, right? But so newer approaches has to take time, and time is measured in not 1-2 years, but usually 5-10 years, decades. Okay, so that's the reason why many oncologists will not agree with you. But that is not true today. I just shared with you. I went to Mindanao and I spoke to a whole room of surgical oncologists. They were very open to the protocols I shared, and very quickly they were asking me, how can we work together? So we are even doing, I'm working with some hospitals regarding doing, how shall we say, initial studies on how we can support chemotherapy. Okay, now many doctors, if they're not informed, if they're not inclined, if they are very, how shall we say, conservative, sticking to whatever they were taught in school and governed by their specialization, they will stick in their lane. They will really stick into their lane. So I won't say that the doctors don't agree because they seriously don't agree. I would say that they don't agree because they have to stick to their lane. Right? They have to stick to their lane. But we're making progress. Okay. The good news is that we're making progress. So we're working with more and more oncologists. At the end of this year, Simply Nature is actually going to participate in the Philippine Society of Oncologists. So we will be presenting how we can support the oncologists in their work to be able to minimize the side effects of chemotherapy so that more people can use chemotherapy and immunotherapy. So I hope that for Ms. Rivera, that your frustration, okay, will start to disappear as Simply Nature as a company, as we make our effort to inform and work together with more and more oncologists. I hope that in 2 to 3 years, that we will be able to, how shall we say, make a difference, because I'm personal friends with very senior oncologists, and they are really, really very nice people. And even among the most senior oncologists, there is a big turn towards using less chemotherapy, less surgery, less radiation. All right. So from the top, there is beginning to be a move to try and make treatment less, I should say, less side effects. Okay. So I think this question that you asked is going to become better and better every year. So when we are doing our 200th episode, if you ask this question, hopefully this question won't even come up anymore, because many oncologists would be working with us and they will be okay. Now, again, even I would disagree or will tell you to be careful if you're using chemotherapy and, for example, traditional Chinese medicine. Remember, I told you I studied traditional Chinese medicine, so I will tell you to be careful to use herbology. That means Chinese herbs in tandem with chemotherapy. So there are real reasons why oncologists are usually very, I guess, skeptical or maybe cautious and careful, because if they don't know the protocol you're using, right, then they will be afraid that the protocol you're using, for example, PPAR protocols, if they never met me or our team of med reps, then they don't know. They have not been presented the data, so they don't know. So they'll definitely be very cautious whether there'll be any contraindications, whether it will affect the chemotherapy that you go through. Okay. Now, for those of you who are undergoing chemotherapy but are interested in looking into TCM to support your chemotherapy, then I'll tell you one thing that is safe. Okay. Acupuncture is safe. Okay. So acupuncture will not have any contraindications with your chemotherapy and your immunotherapy. But if you take Chinese herbs, then hopefully you check, because many TCM doctors today are actually also conventional Western medical doctors. So they should be familiarized with the chemotherapy drugs that you use, and they will be able to make a decision whether that TCM protocol that they're giving you will have any contraindications. Now, if you meet a pure TCM doctor who does not know Western drugs, then I would suggest that maybe you do a bit more inquiry just to make sure that the Chinese prescription does not clash with your chemotherapy. But if your Chinese doctor is also Western trained, then it should be quite safe. All right. So I'm giving you some guidelines for you to be able to do some research and make your own decision. I hope that is helpful. And I hope, Ms. Rivera, I've answered your question. Yeah. So my honest opinion now today is I'm a lot more harmed about this. 5 years ago, I would have been a bit more agitated like yourself. Like, why are they fighting us when all our protocols work? Right. So now I understand that it's just about education, and it'll take time to change opinions.
Thank you, Sir Shyan. That's something very promising to look forward to.
Yeah.
Now, next question from Mr. Robin Ruben. Can a person be immune to the effects of immunotherapy, resulting to the lessening effectivity?
Oh, yes, of course. That's the same with vaccines, right? Remember, I gave a very simple analogy, right? Chemotherapy and immunotherapy are drugs. Drugs are very targeted. So drugs have specific effects. However, the virus is able to mutate. So a good example is COVID-19. Remember, your COVID-19 vaccine was effective for the first strain, but later with the new strains that there was Delta strain, and I can't remember how many strains there were anymore. I think there was an Omega strain, and then they had to make changes to the vaccine. So yes, the drug is not adaptive. That means the drug doesn't adapt. But the virus, which in the case is it's not a virus, but unless you're talking about cervical cancer, but cancer is adaptive, is changing. Now, I was very blessed that I actually rented out my Singapore apartment to a researcher. Believe it or not, my tenant, the person who rented my apartment in Singapore, works for a chemotherapy research company. So one day I had dinner with him. I was just talking to him. I said, what's the challenge when you formulate chemotherapy drugs? He says the challenge is this. For example, you're taking chemotherapy or immunotherapy. The drug is working very well. The tumor shrank from 5 centimeters all the way down to 1.5 centimeters. It's like 75% gone. So you're very excited. You are like, okay, the light is at the end of the tunnel. You're going to finish. You're going to be well. Then suddenly, the tumor starts growing again. The reason is because the cancer cell mutated. The cancer cell mutated. Once it mutates and adapts to the chemotherapy or immunotherapy, the immunotherapy and chemotherapy doesn't work anymore. So it not only does lessen the effect, sometimes it can literally not work anymore. Totally not effective, right? So this is another reason why when you go for chemotherapy, you want to take the Simply Nature PPAR protocol. Why? You don't want to have a break, right? If you're supposed to take like 12 sessions or 8 sessions in, let's say, 3 months, you don't want to take 2 sessions and then you have to wait 3 months to recover before you go for your 3rd session. That means whatever you're supposed to take in 3 months, you stretch it to 6 months. The longer time you take, right, the more time you give your cancer cells to adapt to your treatment. So that's why I said earlier, if your body is healthy, if you're feeling healthy, you're in a better position to fight cancer. You can take the chemotherapy side effects. It doesn't bother you so much. Your red blood cell, white blood cell count is maintained at a healthy level, so you can continue to go for your chemotherapy sessions, your immunotherapy sessions, according to the schedule, right? The faster you finish your chemo sessions, the less chance you give the cancer cell to mutate and become immune to the very effective treatment that you're receiving right now. So don't stretch out your cancer treatment. I hope this gives you another perspective and idea why you want to be strong during your cancer treatment so that you don't interrupt the schedule. Once you interrupt the schedule, it's like you're giving chance for the cancer cell. Since you're not attacking it anymore, it's going to try and recover and adapt to your chemotherapy. It's going to try and recover and adapt to your immunotherapy. So yes, for immunotherapy drug treatment, for chemotherapy drug treatment, it can become less effective because the moment you expose your cancer to the treatment, the cancer starts adapting, right? So you want to keep hitting it with your treatment and don't give it a chance to adapt. Once it adapts, yes, the effectiveness of the therapy drops or may stop completely. Now, here you may ask, does this mean also once you start using PPAR protocols that the effectiveness of PPAR protocol drops? The answer is no, because the PPAR protocol doesn't act on the cancer cell. Don't forget, your immunotherapy taints, right? It's like it acts on the cancer cell. It doesn't act on your immune system. It acts on the cancer cell. It acts on the cancer tumor. It paints the cancer tumor red color so that your immune system can recognize it, right? So you can see the chemotherapy attacks the cancer tumor. So the action is on the drug is on the cancer tumor, but the action of PPAR protocols is not on the cancer tumor, it's on your immune system. So the cancer tumor doesn't need to adapt, cannot adapt to PPAR protocol because the PPAR protocol doesn't act on it. So there's nothing for the cancer tumor to adapt to. But our PPAR protocol works on your immune system. And here's the good news about your own immune system. Your own immune system is adaptive, right? We have two types of immune system. One is the innate immune system, which is not adaptive, but we have a second component, which is adaptive immune system. So our PPAR protocol actually strengthens both the innate immune system and also the adaptive immune system. We increase dendritic cell activity. The dendritic cell activity is the adaptive immune system. So the PPAR protocol is something that you can trust and rely on in the sense that it will continue to do its part to strengthen and improve your immune system so that you can fight cancer effectively. Whereas chemotherapy and immunotherapy, you don't want to have a break. You want to be strong because you don't want to allow your cancer tumor to have a chance to adapt to it. Okay, I'm being very repetitive here and I'll stop. But I hope I've given you a clear understanding of how you should approach your chemotherapy, immunotherapy, and the natural therapies that you use to support your chemotherapy and immunotherapy. And of course, for those who want to treat and manage their cancer totally naturally, most natural therapies, most natural approaches to managing cancer doesn't act on the cancer cell. Most actually act on your own immune system. So they are actually very effective. They don't lose their effectiveness over time. Okay, but they may not be strong enough. Okay, so that's another concern, right? Sometimes the natural way to treat cancer may not be strong enough. So that's why we need to have intervention like chemotherapy, radiation therapy, right? So that's the drawback. It doesn't diminish in its ability over time. It's difficult for the cancer cells to adapt to your natural therapy, but sometimes the natural therapy is not strong enough, especially when it's the late stages. So you need to artificially use very strong approaches, which includes your chemotherapy and your radiation therapy. So that's why on our program, we try to have you open-minded, but we also understand if you are in your late 60s, 70s, you may rightfully choose not to do chemotherapy because you want your quality of life. Okay, so every patient is a case-by-case basis. Everything I'm sharing now is general approach so that you can know how to strategize and ask your oncologist the right questions so that you know how to make your decisions. And of course, if you really want, come to our SMX Live on July 27th. Dr. Jansen will be there to answer the integrative medicine. Dr. Jimmy Katapia will be there to give you the perspective of a surgical oncologist and chemotherapy. And I will be there to give you the perspective of how these protocols work in tandem, all right? And you can ask us live questions.
Yes. Oh, another related question from Ren Cures Zurbano. How about the autoimmune disease, like multiple sclerosis in particular?
You see, then again, very wonderful, right? If you take a drug for multiple sclerosis, it works on the multiple sclerosis, right? For us, PPAR protocol, it doesn't work on the multiple sclerosis. It works on the immune system. So again, can it help? Yes, it can help. Now, is it able to completely treat your multiple sclerosis on its own? It's case-by-case basis. I have met multiple sclerosis patients. I can tell you that they continue to take a PPAR protocol, but alone, it's not enough. Okay, alone, even though PPAR protocols are so powerful and effective, it will give you more, not just help you in your multiple sclerosis, it will help you with any comorbidities that you may have developed. And of course, once you have multiple sclerosis, your quality of life is affected and it's easy for you to develop other issues as well. So of course, the PPAR protocols, our tablets, our extracts will help you maintain a good health. So it's really great, but will it be able to successfully treat your multiple sclerosis alone? My experience is no. Okay, will it help? Yes. Is it an important part of your treatment? Absolutely. But I would say, though, continue to look for other combinations when it comes to multiple sclerosis. Now, to other immune deficiencies, we have had successful cases with lupus, with other autoimmune diseases. Now, again, the wonderful thing that I'm sharing with everyone that I hope everybody understands tonight is this. Natural therapies are very effective in getting rid of the root cause. Root cause. That means solve your problem right at the root so it doesn't come back again. However, right, here's an example. Here's something to help everybody better understand. Imagine you have a deep cut in your hand and you are bleeding like Meron, a water fountain. Okay, the blood is spurting out, you're freaking out, right? So what must you do? You must first close the wound, right? You must first close the wound. You have to stop the bleeding. You have to stop the bleeding, right? You have to maybe sew up the wound, bandage up the wound. Now that is your conventional medicine. Conventional medicine is so good in critical stages, right? It doesn't heal the wound, diba? Right? Just because you sew up the wound doesn't mean the wound is healing, right? But the first thing you need to do when you have a cut and your blood is spurting everywhere is to close the wound. All right. So if your cancer is at a serious stage or in your immunodeficiency, let's say your lupus, or even your diabetes or your high blood cholesterol is super high, that any moment you could have a stroke. For diabetes, any moment you can go into shock. Then you know what? Take that insulin injection, right? Take that medication, right? It's like closing the wound. You close the wound. Now, natural therapy is really good at healing, right? Healing, removing the root cause. But sometimes your medical condition is so serious, the healing cannot take place until you stabilize the condition. So that is my advice to anyone who is very pro-natural in your treatment. I'm also very pro-natural in my treatment. I try not to take antibiotics, but I do. I will allow my body to fight the fever for 1-2 days. It's more like a workout, go to gym, make sure my immune system is actually exercising. But I need to go back to work, right? I have responsibilities. I have to do this program on every Thursday. So if I'm sick, let's say I fall sick on Sunday, I will let my immune system fight Sunday, Monday, maybe half day on Tuesday, and by Tuesday evening, I'll be taking my antibiotics already if I'm not able to overcome it naturally. Why? Because I have to do this show on Thursday night, right? So so that's how I manage natural and conventional. All right. So don't be a pure advocate of natural. Don't be a pure advocate of conventional. The absolute truth is each has its own place. So don't put your health at risk simply because of ideology, simply because you are pro-natural or you're anti-natural, right? Don't because of that put your health at risk. Be able to look at the thing objectively. There is a place and proper timing to use both natural and conventional, and they all have a place. And I hope a program like ours helps you better decide. Okay, so rule of thumb: if you're critical condition, if you're very serious condition, please don't fight your doctors. Conventional medicine is absolutely the best in stabilizing your critical condition. However, I would say for most cases, natural therapy or natural approaches, right, is the best way to totally heal you of your condition. So you now know how to use both. Okay? All right.
Thank you, Sir Shyan, for that very honest answer. We were almost at the end of the webinar, so this will be our last 2 questions for tonight. Okay, coming from Mr. Nelson Estropia. Where can I watch a recorded complete video of this topic or discussion?
You can go to our YouTube channel, all right?
Yes.
Can we even share screen? Maybe Junie, if you are able, can you flash our YouTube? You can go to Simply Nature YouTube, International's YouTube, and maybe flash it out so that our viewers can see what it looks like. Okay. So Junie, please prepare that in the background. When you're ready, just flash it up, but we'll continue with there you go. All right. So you can see, you go to YouTube, you type Simply Nature, and then this is our webpage, our YouTube channel. There are literally hundreds of videos. There you go, the live webinar series. So you can look for all the series. There are like 100 plus All right, so you can look at the title and then you can see the recording and you can go and look. You can also see our success stories, our latest testimonials. That's very encouraging. People who how they fought cancer and their different strategies. You can see we have down here Doctors Forum. Right, what is Doctors Forum? Doctors Forum is not our Thursday Simply Heal. Okay, Doctors Forum is when the content is more technical. The audience is actually medical doctors and medical industry workers, right? So what we talk about there is a lot that I will not use layman examples. I won't use example of a bandage wound or whatever, right? We will actually talk medical terms in those doctor forums. But for those of you who are interested in more technical, you can always look at that. And then anytime you can make comments and messenger us. And then we have both healthcare specialists and client service officers. You know, Ms. Jhen here is a fully certified, board certified, and top board scorer, all right, for pharmacists. She's a licensed pharmacist. So in Simply Nature, many of our team members are all medical professionals in one aspect or another. Ms. Beth, which many of you will know as our healthcare specialist, is a licensed lifestyle medicine health coach, licensed by the Philippine Lifestyle Medicine Caucus, right? Yeah, so that's a actual field in medicine. All right, so there you go. I hope that gives you the confidence, and you can see that we also featured on CNN Philippines. So yeah, any last questions?
Yeah, before we go to our last question, let me first read the very encouraging comment of Miss Amelia Rivera. She says, "Thank you, sir, for a clear answer. And I do agree with you, sir. I will continue to watch and support your program. Honestly, I'm learning a lot of info and help me also somehow in educating my clients. So I continuously share this informative and educational program of Simply Nature International."
Wow, thank you very much, Ms. Rivera. To all the viewers tonight, you know, if you are a cancer patient, please, there are two options that you can do tonight. Number one, you know, go for a consult with Dr. Jansen. Simply say, I would like to have a consult with Dr. Jansen, and we can arrange Dr. Jansen's healthcare specialist from SMG will actually then help you book an appointment with him, right? He's available for face-to-face, but I will encourage you for cancer patients, first consult can definitely be done via teleconsult. So you don't have to brave hours of traffic and wait in a hospital in a queue, right? So you can quickly ask your questions. Now, if you don't know whether you need a consult, you can just again indicate that you would like to know more, and Ms. Beth can talk to you and you can ask her whether you need an actual consult. For those of you who want to know more about Simply Nature's PPAR protocol and how that helps you, whether you have metabolic syndrome, immunodeficiencies, eczema, psoriasis, or even especially cancer, our customer service team, like Ms. Jhen, right, are fully qualified professionals. She's a licensed pharmacist, right? So she'll be able to answer your questions about what would work. And if need be, if your condition requires a doctor's consultation, they will refer you to a doctor that works with us. So that will help answer Ms. Rivera's question, right? The doctors that we refer to you are actually very renowned doctors. Like Dr. Jimmy Katapia is actually the head of the cancer center at Manila Medical Center, right? So I believe he's the head, right? Yeah. The last time I talked to him, he is, but I'm not sure whether he's still the head this year. But he was the head of the Manila Medical Center's Cancer Center. All right. So these are very qualified and renowned doctors, famous doctors that we will refer you to. And obviously, they don't share the same objections, or they are actually very open and they actually will work with our protocols and protocols like us. Okay. So I hope I've given you hope and direction. I look forward to our team assisting you in any of your treatment journey. And you know, we take pride, I guess, in staying with you throughout the journey, answering all your questions and taking time to make sure that you understand the decisions that you are making.
That's right. So for those of you who wish to have a consult with Doc Jansen Kalalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialist, Miss Beth and Miss Irish, will reach out to you shortly. Now down to our last question from Miss She. How can PPARS liquid help people who undergo chemo?
Oh, wow. Okay. PPARS liquid is our most powerful extract. Okay, so for chemotherapy, as a chemotherapy, since this is a very direct chemotherapy question, and it will be related to tonight's topic of immunotherapy, because like we said, very many times chemotherapy will come before or even together with immunotherapy. Okay, so the liquid extract is your best protection for chemotherapy. Okay, it will actually protect your bone marrow cells, your spleen cells, and your all your healthy organs from the cytotoxicity. That means the poison from chemotherapy. Obviously, chemotherapy works because it's poison to the cancer cells, but it's also poison to your healthy cells. So we have done research to show the mechanism how we protect your bone marrow cell. Now, very important is your bone marrow cells. Why? One of the common or almost, I wouldn't say universal, but almost universal side effect of chemotherapy is that your red blood cell count will drop. Okay, now why? And if your red blood cell count drops, you cannot continue your chemotherapy. Okay, because obviously your blood cell count is important in your body. Now, our PPA protocols will actually help bring up your red blood cell count. Okay, the mechanism is a bit more complicated, but basically, for those of you who do understand or find it easy to understand, that it helps with cell delineation. It helps your blood stem cells mature into red blood cells and white blood cells. So basically, that will help increase your red blood cell and white blood cell count. For those undergoing chemotherapy, it'll help your body maintain the red blood cell and white blood cell count, which allows you to continue your chemotherapy successfully and also with less side effects, from weight loss to nausea to hair loss. Of course, from patient to patient, it will differ, but it will definitely be helpful and support your chemotherapy effects. Okay, so the liquid is the best. So if you are undergoing chemotherapy and you're having severe side effects, it's very difficult for you, and you almost have to stop, or you have to stop your chemotherapy because your body can't take it, then go straight on the liquid, right? The dosage will be 1 vial, but if your condition is pretty bad and you want to quickly get well, then 2 vials a day. How fast will you see the effect? The worse your condition is, the faster the effects will be felt. And what would you feel? You will feel what we mentioned earlier today, which is important for your fight against cancer. You will feel better. You'll feel stronger, right? If you were bedridden, you'll now be able to sit up. If you're always sleepy, suddenly you'll be more focused, way more conscious. So strength helps you be able to continue with your current protocols, right? Allows you to go back on your chemotherapy, allows you to go for the surgery that you need, right? So that is what our liquid extracts will do. So if that's your condition right now, then immediately make a comment and ask for assistance and more information, and we'll have qualified people to assist you.
There we have it. It looks like we've covered all our questions. So if you have any follow-up questions, don't worry. We will answer each of your questions next webinar or via direct message. But just before we say goodbye, can you give our viewers your parting words for tonight, Sir Shyan?
Oh, I just want to thank everybody that, you stayed with me, and and I really want to thank Ms. Rivera for asking that question. And I'm so glad. Thank you for your feedback, because it helps me know that my explanation brought you some clarity, right? Brought you clarity. And for everyone else, I think it's so important. I meet with so many doctors, and the doctors that I meet, that I enjoy meeting the most, is the senior doctors, because these are the doctors in their mid-60s. They are the top of their field, right? And they are more mature. They're more wise. They don't just like advocate of what they say. As a person ages, they become more wise. When you're younger, you're hot-tempered. Your way is the only way, right? When you're young. But as you grow older, your wisdom, you start to realize, you know what? I was wrong when I was younger. Actually, there are other methods. So I do enjoy meeting very senior doctors, oncologists, surgical oncologists, doctors in other fields. All right. And what I found in common is this. So this is the encouraging last word. That you know what? The more senior the doctor, the more I realize they're actually more open to more approaches to treating cancer. And one of the most unforgettable experience I had was when I was speaking at the National Children's Hospital. One of the senior oncologists, now this one is a medical oncologist, actually stood up and mentioned that that doctor said, we are open to novel approaches to cancer treatment. We would really like to see what other methods there are to support a cancer patient. Not to say that they don't believe in chemotherapy or radiation therapy or immunotherapy, but they realize after being around so long that patients are suffering and that they would like to find more options to make that cancer journey easier and more successful. So on that hopeful note, that even oncologists, senior oncologists are looking for new protocols to support their existing protocols. I leave that with you, and I look forward to answering your questions next week again. So have a great week ahead. Jhen, I'll hand the time back to you.
Thank you so much for tonight's session. And to all our viewers, we hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. For next week, we will learn how to prevent the painful symptoms of prostate cancer. But for tonight is the start of Lazada 66 Wow Sulit Tipid Sale. So check out participating items like cleansing tablets with polyphenols such as resveratrol and PPARS Extract Soft Gel Capsule for prevention of cancer recurrence and metabolic diseases, up to 29% off, only from the official Lazada Mall of Simply Nature. I would also like to congratulate all the raffle winners earlier this afternoon, Miss Jeneline Jemmy Chan Ang, Marian Tolentino de Guzman, and Aimee Yanko. Lastly, this July, we are calling again all cancer patients, survivors, and advocates. Let us all come together to beat the odds using medical nutrition, oncology, surgery, and PPARS in fighting cancer. This seminar isn't just about learning, it's about empowerment. Every health journey is unique, but you are never alone, and together we are stronger than cancer. You can reserve your seats as early as now via GCash payment. So just scan the QR code you can see on your screens. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself. How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed,
the tumor was gone. It's just a cavity. It's not enhancing.
Now you know, cancer eats what? Cholesterol, right? Simply Nature people can lower what? Cholesterol. Now you understand why you're taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product, just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening, right?
Especially if we are talking about solid tumors. The number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong, plus very honest sila sa mga questions, sa mga pagsagot sa mga questions. Basta, nasasayahan ako. Ganun.
We're always with you from start to finish.